how can you best prepare for stem cell therapy or MSC therapy or Wharton's jelly or exosomes or whatever you want to call the product? There's variations among them, so that this investment that you're making in your health has the best potential for the best outcomes. I'm Joya Vanderlaan. I'm a family nurse practitioner, board certified nationally, and I do regenerative injections and infusions in my practice. And I always want my patients to get the best results, because if they're investing like this in their health and in their recovery or looking for pain relief, I want them to get the best results possible. I feel better if they get the best results possible. Of course, the patient feels better if they get the best results possible. So what are some things you can do if you're getting these injections that make it the most likely for you to benefit, the most that we can have you benefit from them? So one of the ways that these stem cells or Wharton's jelly exosome infusions work is that they decrease inflammation, or modulate inflammation, I should really say, because if inflammation is needed in order to heal, they will encourage the body to do that. If a decrease in inflammation is needed, they will encourage the body to do that. And then also it sort of modulates the immune response. Immune response is part of healing, but again, if it's overactive, then you're not going to get as potent, as good of results of healing. And then also it causes tissue regeneration by calling all sorts of the body's resources to the area to heal. And so one of the things we want to think about is, what is the environment that we're putting this product into, whether it's a joint injection or an IV infusion of these products? What is the environment like, and have we prepared the environment? You know, sometimes I like to think of this like planting a seed in soil, and I will not claim to be a master gardener. However, if you plant a seed, a valuable seed like the exosomes or the Wharton's jelly, if you plant that in soil that has no moisture and no fertilizer, no nutrients, minerals, it's rocky, that seed probably will maybe grow, maybe it will grow, maybe it won't, but you're not going to get the growth out of that seed the same as if you till the soil, make it loose, add some aeration in there, fertilizers, whatever else really good gardeners do, right? I'm a gardener of the body, not a gardener of the soil necessarily, but the analogy stands. So a lot of times what I'll have people do is, first, let's do nutrient testing, hormone testing, get you optimized there. Make sure that you're not having a ton of sugar, excess sugar in your diet, or seed oils, or processed foods, or bad fatty acids, or alcohol, definitely not smoking. You know, these are all things that if we can do them right and get as close to optimal as possible for at least a couple weeks before the injections or infusions, that is going to lead to the best outcomes in terms of post-injection, post-infusion. What I want to do first when I see a patient who's a potential candidate for any kind of regenerative therapy is assess those things. What is diet like? How about sleep? What about stress? What about exercise? Nutrient status? What's the vitamin D level? What are HSCRP levels? What's insulin level looking like? And then if any of those is off, work towards optimizing those for overall health, of course, but then also so that we have the best chance that that regenerative treatment is going to work as good as possible. Something as simple as hydration can have an impact on how well somebody does or how well they benefit from these regenerative treatments. We want to make sure that hydration status is on track. We want to make sure that the patient's been getting enough sleep beforehand and also then after the injections. We want to make sure that exercise and activity is part of a patient's life, but maybe not in excess. Because, for example, with a knee arthritis, if I inject a knee with Wharton's jelly and the patient immediately the next day goes back to squatting and deadlifting and, you know, back squatting, front squatting, whatever it is, if they really load that joint and put stress on the joint, as you can imagine, there's going to be some degeneration that happens. We want to give those injections a chance to work. And so for about 6 weeks or so after, modified activity. The other thing that I always want patients to do is at least consult with a chiropractor or a physical therapist, because looking from a functional medicine perspective, there may be an underlying physical structural cause for the degeneration or the joint pain in the first place. And for example, if your alignment is off with how you're walking, or you have a weak side, one side compared to the other, we want to get that strengthened, because although the injections can work to regenerate tissue, if we don't correct the underlying imbalance, then that tissue is going to be prone to breaking down again over time. And we want as much as possible for this to be a one and done situation with the treatment. And maybe in 10 years, 5 years, 10 years, you may want to have another injection. But the goal here is not to do regenerative injection after regenerative injection. This should be one injection, really provides a good deal of benefit. One recent really inspiring patient success that I had was a middle-aged male, 40-something, came in with pretty significant knee issues, had been a high-level athlete in his teens and early 20s, came in after having multiple surgeries on his knee, and we injected the knee with Wharton's jelly product. And within 24 to 36 hours, significantly less pain as a result of the decreased inflammation. And within the weeks following that, just significantly less pain, significantly more function. He did test out the running a little bit, maybe more than I would have recommended, but he actually did really, really great. And still to this day, 3 months later or so, is doing so much better than what he was. He's playing with his kids again. He's participating in the activities that he loves to participate in. So he's back to living his regular life. It's great. To recap, you certainly could get an injection of Wharton's jelly, exosomes, whatever it is, without doing anything ahead of time. You would benefit from that. My goal, though, is optimization always and getting the most bang for your buck. These products are a little bit pricey, and I always want people to get the most value from it. I feel better that way. Patients feel better that way. So to do these things ahead of time and then after the injection, that can make it the most successful possible, that's my goal. And providing individualized, really specific, personalized care really works best. I love doing these treatments. They're so impactful on patients' lives. If you have questions or you're interested in receiving these treatments, you can go to our website, nourishhousecalls.com, and you can book a discovery call where I'd be happy to sort of evaluate your case, go through that, and determine if you may be a good candidate for regenerative treatments.